And today we are sitting in our dean office, and we're going to talk about our syllabus and medical curriculum. So, and can you introduce yourself?
Hello, I'm Divya Sharma. I'm from first year. I'm a medical student in Perm State Medical University, and I'm here to take guidance from my senior.
Yes, let's hope I help her. And so, tell me, Divya, how many subjects do you have, and which subjects do you have in your first year?
Okay, in my first year, I studied Russian and other languages and other subjects, but the main subjects were anatomy,
Yeah.
histology,
Yeah.
basic surgery, and physiology.
Okay, that's great. And did you like anatomy?
Yeah, very much. It's like a subject of my interests.
Okay.
So I had a lot of fun studying anatomy here.
So, what resources did you use?
Um, the university has divided anatomy in three parts.
Yeah.
So
which we have every other year, like in
Yeah.
second. Yeah.
So we had anatomy, and later on we'll be having pathanat and toponat.
Yes.
And for now, we had bones, upper limbs, lower limbs.
And the system wise.
Yeah.
Yeah. I'm sure you had a teacher, Lucy ma'am and Uksana ma'am.
Yeah.
Yeah, they are amazing. Uksana ma'am is very eager to teach us because she likes to, first of all, for her we are very different. So she has to teach us in English, and she tries her best so that we can understand. Her English is amazing, and even Lucy ma'am, she literally takes. I'm sure she must have shown you bones and
Yeah, the
and
cadavers.
yeah, cadavers also, and then she also shows skeletons, and then she points out that this is this, this is that. So she's very helpful.
Yeah.
And I'm sure you're going to have Arthur sir. He's very strict, but he's one of the best teachers here in for anatomy. And he takes the exam like everybody's so scared of him. Like I hope you do, yeah, impress him.
Yeah. We had Oksana ma'am too, and
Yeah.
she was very sweet and
Yeah,
kind.
she's very sweet.
And she would help us with our questions,
Yeah.
and she's always ready for our.
Yeah, she's
She's always ready helping us.
Yeah, you can ask her anything and she'll help you. Like recently in sixth year, I am now in my sixth year, and we had anatomy sir, which coordinated with Oksana ma'am, and he was Azam sir, and he taught us so good, so good. Like we made notes just for he came just for 4 days, but the university, Ras Education, brought him here just to help us.
Yeah. I
And
attended those classes
he
too.
was Dr. Azam sir, university for the MCI exams that we are going to have very soon in December. So for that, he's an amazing teacher. Yeah.
That was quite helpful. Like even as first years, we could have introduction to the other year classes.
Yes, yes.
And subjects.
Yeah,
We had
he
neural
started.
and-
He started from the basics. He started from the little base first year. Like even first year, I'm not sure if you
Yeah.
attended it, but there were a lot of first year students too.
Yeah, I was one of them.
Oh yeah, he attended. That's great. And what about physiology?
Physiology also, we're having a great time. Oksana ma'am is taking physiology. for us.
Okay, yeah, and I referred the book guidance. So have you?
Yeah,
read it?
it's like they call it the Bible of physiology.
Yeah, it's very nice. Guyton helps a lot.
Yeah, and the PDFs that the teachers make here, they are based on these Indian
Yeah,
books.
yeah. Actually,
books
like
and-
for the college exams, it's better if we do it from the PDF. So it's
Yeah, quite
more
helpful.
important
Mhm.
and concise, a little bit concise.
Yeah.
So that's very helpful. And what else? What's another subject you have?
We had
And-
histology.
Oh, you have. I
And-
don't like histology.
Yeah, it's a little difficult to cope up with histology.
Yeah. What book did you refer?
We refer the PDFs by teachers. They were
Okay.
more helpful.
Yeah.
But
And also we have-
otherwise, Dr. Indar,
Sing, yeah,
Yeah.
that book is also like most of the students in India and here use that in the using. Yeah, histology though they show us slides and different
Yeah.
types of slides are on
it's
display
interesting,
whenever
but
you can
a little difficult.
see. And you must also have basic surgery.
Yeah, we had basic.
Like
area
yeah,
of
like in next year
patients,
you'll have
yeah.
facultative surgery. Then in my year I had hospital surgery. Right now you had basic one. and then we also have path related to pathology. Also, there's surgery, so it's amazing. And what else? What book did you? I guess you also referred to PDFs more
Yeah,
for basic
more of
surgery.
PDFs, right.
Yeah,
We also had practicals, like it was really nice meeting patients.
yeah. They take us to the hospitals
Yeah.
and just let us interact with them, and yeah, it's very helpful. So, any questions you have for me?
How was your experience here, like the second year, third year?
Yeah, the second year currently, like I don't have the whole memory of my second and third year, but I guess in second year I had biochemistry, and I really at first I hated biochemistry honestly, but after some time मुझे अच्छा लगने लगा. जब आप अच्छे से पढ़ो और एकदम डिटेल में एकदम बेसिक से स्टार्ट करो ना, तो वो एक्चुअली काफ़ी इंटरेस्टिंग हो जाता है. एंड उसके चार्ट जैसा एक चार्ट है उसका, एक बुक में मेरे को मिला था, और वो चार्ट इतना ज़्यादा हेल्पफुल है कि आप उसको बस एक बार खुद से लिखते रहो बार बार, एवरी डे आप लिखते रहो, एंड फिर उससे वो बहुत हेल्प हो जाता है. और क्या बोलते हैं, और कौन सा सब्जेक्ट था मुझे, इमरजेंसी मेडिसिन भी था, और वो मैंने ज़्यादातर पीडीएफ से ही पढ़ा. टीचर्स, हमारे जो टीचर्स थे उनकी पीडीएफ से ही पढ़ा, वो ज़्यादा हेल्पफुल था. और माइक्रोबायोलॉजी, आपने कभी पढ़ा है माइक्रोबायोलॉजी?
नहीं.
माइक्रोबायोलॉजी बहुत ज़्यादा पोर्शन है इसमें, और वो क्या बोलते, इसमें बहुत कुछ बोलने के लिए पढ़ने के लिए होता है. माइक्रोबायोलॉजी में बहुत बड़ा पोर्शन है, बट it is also actually interesting.
Okay, and like I'll be going to second year now, so like what are your suggestions for me, like
Okay.
how I can study well?
First, I'll tell you to concentrate on the subjects that are going on in the university, because अगर हम लोग को ऑब्वियसली खुद का अलग से भी पढ़ना ज़रूरी है, हर मेडिकल स्टूडेंट को ज़रूरी है, बट थिंग इज़ अगर हम अभी सेकेंड ईयर में हम हमारा खुद से पढ़ना, तो नोट्स बनाना ठीक है, वो थोड़ा पेस थोड़ा स्लो होगा चलेगा, क्योंकि क्या बोलते हैं, बाद में वो सब चीज़ें क्या याद नहीं रहती हैं. सिक्स्थ ईयर तक आते आते मुझे आई डोंट थिंक ज़्यादा कुछ याद है जो मैंने सेकेंड ईयर में पढ़ा था. मेरे जो नोट्स हैं मुझे बस वो हेल्प करते हैं. सो उसके लिए आपको नोट्स बनाने की ज़रूरत है, और धीरे भी पेस जाएगा तो चलेगा, एंड बाकी तो मोस्टली तो कॉलेज पे ही कॉन्सेंट्रेट करना है.
Also, could you like suggest a few books that I can use for me?
Okay, for biochemistry, I'll say fundamentals of biochem. I prefer that, and also for emergency medicine, actually, it's better to have the teachers only say about it, the PDFs they have and everything, and and the other subjects, microbio. For microbio, I referred mostly notes from all over, but for microbio, first of all, because it's such a vast subject, I first used the PDFs that the teacher gave, and then I chose the
The
book.
PDFs from the teachers in the universities are like so helpful.
Yes,
and
Anant Narayan.
precise,
Yeah,
right.
I for microbiology. Then first the PDFs, then I chose Anant Narayan too, because at the start, if you just started, maybe it's a little, it might be a little difficult
to understand.
Yeah.
And like, what about the clinical observations that we had like during the summer holidays?
Yeah, we have opportunities to study them in India. Like when you go for a summer vacation, you can just join you can look for the summer practice that we need to do. They give us a booklet. Our college gives us a booklet, and according to that, we need to cross check everything that, and we need to fill basically, as in the hospital, we need to tell them that our college requires us to do this. Can you please? And they will allow you, and so on. You just do all the necessary things that you need to do in your first year or second year.
Okay.
Yeah.
Also, like, you remember we had a fair here in which like the students were allowed to interact with the robotics.
Oh yeah, robotic simulation. Yeah,
Yeah.
that's education. In our university PSMU, we have robotics simulator, and,
And
it's a lot developed.
Like my classes had not properly started at that time, but I attended the parent. It was quite helpful, like so educational, and it gave us a good experience.
Oh, that's great. Yeah,
Yeah, like delivering a baby using.
I have been there too.
It was quite
They
nice.
also, like, there was also a fair where they help us with surgical techniques. How to,
Yeah,
I
this-
had attended that in last year only.
Okay.
Like you get to stitch a pig's
Mhm.
skin, or then they teach you intubation, and they teach you to like just to hold a baby, how to hold a baby, and or how to wrap them so they are warm. All that from basics to
Performance
yeah.
CPRs and all of those.
All 19 subjects are cross that we require for NEET or maybe MCI or all the other subjects, all the other exams globally, like USM.